Hello, my name is Diana Bueno, and today I will be doing advocacy for occupational therapy. The reason why I chose this topic is because I am a certified occupational therapy assistant, and I just feel like advocacy is very important for the field that I am in, and I feel like just more awareness overall of what occupational therapy is and the current things that are going on with occupational therapy is something that needs to be addressed, and I feel like it's very beneficial to educate the population on what's going on. So just a little background on me. I graduated from STC 5 years ago. I was the class of 2013 for the OTA program. I have been in the pediatric population for the past 5 years and counting. I love what I do. Of course, occupational therapy is it's found in the school setting, it's found in the therapies, in the nursing rehabs, in hospice, in NICU. It's found all the way around. Specifically for me, the population that I see are the babies, the pediatric up to 18 years old. And what we do is we treat kids with autism, with developmental disabilities, cerebral palsy, Down syndrome, spina bifida, and also behavior modifications for some certain patients that have ODD, which is oppositional defiant disorder, and PDD, which is pervasive defiant disabilities. So that's just something that that's the kind of people that I work with right now, but I mean it can go beyond the age ranges. It's all age ranges. And basically what occupational therapy is we provide therapy to make the patients and the client as independent or as functional in their daily lives as possible when performing ADLs, which is activities of daily living, or just basically life skills. Showering, getting dressed, being able to eat, performing certain roles that they may have, such as being a gardener, being a student, being a mother, being a father, being a teacher, things of that nature. We make it very client-based, so whatever they need or want to achieve, we're able to be in that position for them to get them as close or get them there so they can be functional. So that's what's been going on in occupational therapy. In the news, I'm not too sure who's really paid attention or not, but what's been going on with occupational therapy and with Medicaid is that Texas lawmakers have decided back in 2013 to make the STAR program, which is Medicaid managed care for kids with disabilities and things of that nature. And when that resulted, what ended up happening around that time also is they ended up implementing a $350 million Medicaid cut specifically to the pediatric population, which has resulted in kids being denied services, not being able to get as many visits as we feel is justified for their case, and they're being turned away. And a lot of the times the kids, I mean, obviously if their family's on Medicaid, that means they don't have the finances or the financial means to pay out of pocket, which means these kids are kind of being left on the side. And I feel like that's something that we as a community and just as humans in general, we need to be there to make sure that people who need services are able to get that service without, growing broke or without being, poor or having to sell a house to do so. So just a quick little glance. As you can see right here, I'm not too sure. One of the main reasons why they feel that it's justified that Medicaid is cutting is because Texas A&M conducted a study for the lawmakers, specifically stating that the Medicaid reimbursement rates in the state of Texas were extremely high compared to the rest of the nation, and it is very true. It was really high compared to the rest of the nation. So the lawmakers felt it was justified to cut it and make it go straight across the board to give it an even playing field, which resulted in the $350 million cuts. But the state of Texas also didn't ask for another study from Texas A&M on the consequences that would happen when these budget cuts would become active, which is what we're seeing now as the kids, they're declining, they're being turned away, because if they're homebound or they have very severe disabilities, they are ending up in the hospitals because the treatments that they were receiving in occupational therapy, specifically when they're not being performed, those can lead to contractures, they can lead to decrease in passive range of motion, like it's a trickle effect, and that's why we feel the job that we do is very important. So that's one of the reasons why they're doing the cut. So they did the cut in December 2016, the $350 million cuts, and then they also decided, because of the petitions, there was families, there was healthcare providers that went and they protested. They got 250,000 petitions for the lawmakers to kind of, end up switching it back or trying to, get money back so that way it wasn't as deep as a cut. And the following year, the best they were able to do, Texas lawmakers, was to put $24 million back into the system, which is basically a fraction of what they had initially cut, was $350 million. So they did help, but it was very minimal. And as of this past September, they decided to do an additional cut, specifically to assistants, which is what I am, not only OTA, but PTA and speech assistants. The Medicaid reimbursement rates per visit would be cut 25% if the patients are seen through an assistant and not the OTR or the physical therapist or the speech therapist, which I feel is very unjustified because although we don't do the evals and the discharges and the re-evals, we are still, it still doesn't justify that we are specifically called out to get a cut, but that's another thing inside itself. So this is just another map saying that currently 3.4 children, this was back in 2017, 3.4 million as of right now, they're on the Medicaid children right now, and that's where lawmakers saw, well, this is the biggest spending, so we're going to cut from that. Specifically what Governor Josh Abbott wanted to do was he wanted to use that money from the cuts and send it specifically to Texas borders. It was for an increase in the border guards, for whatever border security that was going on. That money went there, and that's why basically all this is happening right now. And it's not necessarily me, just because I'm a therapist, that's being affected. It is the clinics. Like I said, some of them are being closed down. But we can't forget the main reason why we do this job is for the patients. So just real quick, here's an example of a patient who, his name is Sean Bears, and he was 11 years old when he got hit by a car, and it resulted in him getting a TBI. So this is currently what the family's having to deal with.
Brain injury patients have a certain window during which they have the best chance of recovery.
If you want to grab around his face and just kind of hold him, make sure his head's not popped back.
They have to have therapy in order to recover. They have to have intense therapy. Should you say, well, this is our chance to get our son back. And they're denying him the therapy that he needs. I see you trying. Good job. I would sell my house and live in a cardboard box if it helped my son.
Let's put it on. So, where do you go? On our website.
So that's just real quick. I'm just going to show you a little bit of the video. But basically, that is what some of the kids have to go through. That is their lives right now, because some families depend on Medicaid and other insurance companies are saying, hey, well, we really can't justify 2 times a week, but we'll give you 2 times a month. And that's when the gaps start happening like that. That's when all the passive range of motion and the contractures and all these other, you know, kind of consequences of their health happen, and they end up hospitalized, and they end up even more severe. And in the long run, I feel like Texas lawmakers and Medicaid's going to see a jump in the Medicaid hospital bills, because we are not there for preventative or for current treatment of these kids, which is very sad to see, especially in a kid like this who's really in dire need of therapy. So right now for the OT in the community, we are always trying to make our voices known, let our OT, you know, what we do, like trying to be advocates in the community. We're always there. We're always trying to help out kids in the community, whether we see them or not. We always want to make sure that in the cases of Miracle Kids of South Texas, we do weekends. I'm a volunteer. We get anyone that has disabilities to go get to play putt-putt, go bowling, go fishing at Bass Pro Shop, just other places in general. And we make modifications and we make it handicap capable for kids who aren't necessarily able to do those things, and they're able to just have fun and be a kid, and we're able to bring in those tools so that they're able to perform those actions and kind of just be a kid for a minute and not have to wonder about, am I different or anything like that. That's also the case for the Make-A-Wish Foundation. A lot of therapists I know are in that, that's in McAllen, and they also help, you know, any way possible to make sure that these kids, you know, just really are, that they're having a good time, and they're just, you know, a lot of circumstances may be in their way, but people care about them and we want to see them happy, and that's where the Make-A-Wish Foundation comes into play. The Texas Health and Human Services, specifically for the early childhood intervention, that one is also one that's currently being cut. That was actually part of the $350 million budget cuts, and that one was specifically for kids before they go into the school setting. That is a different kind of therapy that we try to get them to be as competent or at the highest level of learning by the time they reach school, like kindergarten, so that they are not as behind in their educational goals or the rest of their classmates, to just give them more of an even level playing field. There's also school therapists that are in the schools, elementaries, middle schools, high schools. They're there. They specifically help kids target their educational goals. Kids that may have dyslexia, things that, they might need visual cues, things like that. They might be blind, they might be deaf, things along that nature. Occupational therapies also help out in the school setting with that. So we just want to continue to advocate and continue to try to make a difference in these kids' lives, and we try doing it through occupational therapy, and hopefully, the continuing of occupational therapy will increase, and hopefully these lawmakers will find out that it's going to be beneficial in the long run to stop making these cuts and hopefully restore the cuts. So that is about it. So thank you very much.